Hello, and good evening or good morning to those of you joining us from Asia. My name is Karen Eggleston, and I'm director of the Stanford Asia Health Policy Program. Delighted to welcome you today to an exciting installment in our series this winter quarter on health and the environment. We are going to have the introduction of our distinguished speaker today from our partners at Peking University Institute of Global Health. And to introduce our speaker and to moderate the discussion, I'm turning it over to my colleague, Professor Jianan Yang. Jianan, over to you.
Thanks, Karen. Welcome again, everyone, and thank you for joining us today. My name is Jianan Yang, and I'm an assistant professor at the Institute for Global Health and Development at Peking University. Today's webinar, as Karen said, is part of our seminar series this year, themed Planetary Health, jointly hosted by IGHD at Peking University and Stanford Asia Health Policy Program. Today, we are delighted to have with us Professor Ashwin Rode to present his research on the urban mortality consequences of rainfall and sea level rise, a critical issue given the escalating climate crisis we are facing right now. Professor Rode will share evidence from India, which is one of Asia's largest developing nations. Let me give a brief introduction to our distinguished speaker today. Dr. Ashwin Rode is Director of Scientific Research in the Energy Policy Institute at the University of Chicago. At APIC, he's working at the Climate Impact Lab, a multidisciplinary endeavor that assesses climate change impacts around the world. His other research areas include environment and development and the political economy of environmental policy. And Dr. Rode received his bachelor's degree from the University of Chicago and his PhD in economics from the University of California, Santa Barbara. Before I hand it over to Dr. Rode, for our audience, if you have any questions for a speaker during the talk, please enter them in the chat box and I will come to them at the end. Without further ado, Professor Rode, over to you.
Thank you, Jianan and Karen. Can you hear? Okay. Yes, thank you for having me in this seminar series. This work is a joint work with Tom Bearpark of Princeton University and Archana Patankar of Green Globe Consulting. So with that, I'll start the talk. So this is about the urban mortality consequences of rainfall and sea level rise. So flooding affects more people globally than any other natural disaster. And while major flooding events generate international attention, small-scale, frequently occurring, and localized events often go unrecognized. They can be difficult to detect, and as a result, their impacts go unaccounted. In particular, many urban areas in developing countries routinely experience disruptive flooding. For instance, Lagos, Nigeria, in China, for instance, Guangzhou, Jakarta, Indonesia, Manila, Philippines, and Mumbai, India, the setting of this study. So aside from the immediate repercussions of these kind of things you're seeing in the pictures, it's increasingly recognized that the consequences of flooding include longer-term risks to public health from exposure to contaminants and diseases. And then the vulnerabilities to these exposures varies very widely, even within individual cities and within neighborhoods within these cities. So globally, nearly 1 billion people live in slums. And so quantifying these health effects and how they're distributed across the urban population is a formidable empirical challenge. However, it's really essential that we understand this not just for benefits of flood mitigation today, but even more so under future climate change and sea level rise. So the developing world is rapidly urbanizing. So 50 years ago or so, the biggest cities in the world were in the developed countries, but that is rapidly changing. So today, the developing countries are very much ranking at the top of the world cities, world's largest metropolitan areas. And we should take any projection out to 2100 with a grain of salt. But by 2100, the top cities are entirely in the developing world, and some of these projected population magnitudes are just mind-boggling. So we really need to study what's going on in these megacities of the developing world. So this paper provides the first causal estimates of the mortality impacts of daily localized rainfall shocks using novel data from one of the world's largest cities, Mumbai, India. So we bring together a few different data sources here. So first, we have daily person-level mortality data for every person who died in Mumbai between 2006 and 2015, identified by residential address. We combine this with hyperlocal sub-daily rainfall measurements. And then we're also going to exploit the timing of rainfall with respect to astronomical tide height and use this to assess the consequences of future sea level rise on these health impacts. So to preview the results, we find that a day of heavy rainfall causes substantial increase in the number of deaths in a locality over a 5-week period at least. So on average, a day with 150 millimeters of rainfall results in a 2.2% increase in deaths relative to a day with no rainfall. The children under 5 and slum residents are the worst affected. And we find that heavy rainfall during a high astronomical tide period is especially harmful, as high tides are known to impair the carrying capacity of the drainage system and increase the flood hazard from rainfall. So how does this all add up? So rainfall explains a significant portion of Mumbai's overall mortality rate. So we find that 8% of all monsoon season deaths can be traced to rainfall, and 17% of the under 5 deaths. And this mortality burden is borne very unequally. 90% of it is borne by slum residents. And using this result with the tidal variation, the co-occurrence of tides and rainfall, we find that if the sea level were to rise by 0.5 meter, this rainfall-driven mortality burden would increase by 50% if there's no adaptation or re-engineering going on. So this paper, again, is first causal estimates of mortality impacts of rainfall in an urban setting. And also, we develop an approach here to assess the health impacts of sea level rise using these empirical results. So this complements a lot of prior work on market-based impacts of rainfall. We're highlighting here an important non-market impact in human health. There has been work on mortality impacts of extreme temperatures and also mortality impacts of really extreme events like tropical cyclones, but we're bringing this to the routine, like experienced every year kind of rainfall in these developing megacities. And then aside from the economics side of the literature, there is also a literature in hydrology on the links between rainfall and tides, like co-occurrence of those two, and impairments of drainage and increase in flood hazard. However, this hydrology, these facts on the hydrology have never been translated into what they mean for impacts to society. Okay, so a roadmap of the rest of the talk. I'll first start out with some background about rainfall in Mumbai and the the sources we're using to measure that. And then I'll get into the mortality data, the very granular mortality data, and show some stylized facts that emerge out of that data. Then I'll describe the econometric approach, and then the results in two parts. First, the mortality response to rainfall, and then this exercise of attributing historical deaths to rainfall, and then also seeing the implications of sea level rise. And finally, some concluding thoughts. So some background on rainfall in Mumbai. Virtually all of the city's roughly 90 inches of annual rainfall occurs during the June to September monsoon season. And the unique meteorology of rainfall in this setting is going to provide us with an econometric identification strategy. So rainfall on a given day tends to occur in highly localized cloudbursts that drop heavy rain over some parts of the city while leaving other parts dry. So meteorologists who study this, they get very frustrated and use terminology like arbitrary and patternless to describe this. However, the very things that frustrate the meteorologists here are going to be the blessing to the econometrician and provide us with a research design and identification strategy. So we're able to make this work because we have rainfall data from a dense network of these weather stations throughout the city. This network was first put up after a major record-setting flooding event in 2005, where almost 1 meter of rain fell in a 24-hour period. So these stations provide rainfall readings at up to 15-minute intervals, and we're going to we're going to use the raw data to create measurements of rainfall at these sub-daily intervals for each of the 89 PIN codes, which are equivalent to zip codes in the city. So what does this spatial variation look like on the ground? This is an example of 2 different days in 2007 during the monsoon season. So this first one, August 3rd, we see that there was heavy rainfall in the southern parts of the city, while the northern part was relatively dry. And this histogram is just showing the distribution of the rainfall values across the PIN codes. So some of them are very close to nothing, others are in excess of 200 millimeters. And on another day here, June 30th, we see a different spatial pattern. So the southern part is relatively dry and heavy rain occurring on the northern part. So this is the kind of spatial variation we're going to rely on. And so these are just 2 cherry-picked days. What does this look like if we look at like all the days in our data? So this is just the minimum and maximum value across the PIN codes of Mumbai on every single day in our data, highlighting those 2 examples that were shown earlier in the maps. And we're indexing each day by its like average rainfall value across PIN codes. So what we get from this, we see that even on rainy days, there are parts of the city that are dry, and on dry days, there are parts of the city that have quite heavy rainfall. So this is going to be linked up with mortality data. So we get mortality records from repeatedly querying the city government website. And this results in a data set of over 1 million individual deaths. The records contain a number of basic information and basic variables on each deceased person. Interestingly, the name is also included, though we're not using the name information as such. And importantly, the address is provided, so that enables to locate each death to one of Mumbai's 89 PIN codes. So before any questions arise, we do not know the cause of the death, unfortunately. So the results here are going to be all-cause mortality. So this is just what the interface looks like on the website, the government website. I have redacted the names here to preserve confidentiality. So some stylized facts come out of this data, which have never been used in this way before. So if we just map the mean age of death across the PIN codes, we find tremendous variation. So in areas which are known to have high concentrations of slums, the mean age of death is in the 40s. In contrast, in the affluent Breach Candy neighborhood, which is home to several of India's dollar billionaires, the mean age of death is 74 years. So combining this mortality data with the rainfall data, we do see a positive correlation in annual deaths per 100,000 and how much rain fell in that year. This is purely correlative, not a causal relationship. We'll get into the causal estimation later, but we do see some correlational evidence that this matters. And if we look at the seasonality of deaths across months of the year, so this plot is showing the ratio of the death rate by month relative to the death rate in January. So it's normalized to 1 in January. And we find that for all the different age groups, the death rates are significantly higher. They're elevated in the monsoon months. And this is most pronounced for the children under 5. Okay, so that's the mortality data. The other way we're using the addresses, besides locating them relative to where rain fell at the around the time of the death, we're also going to classify the addresses as non-slum and slum addresses to get at this differential vulnerability across socioeconomic groups. So there's 2 approaches here we use to classify addresses. So one approach is to match address text with slum names from the census. So we've got a list of 1,000 plus some slum names from the census. So this is an example of an address where we see the word Dharavi, which is a major slum area. It's widely considered to be the largest slum in the world. So based on the presence of this word, and that's also one of those slum names in that census list, we classified this address as a slum address. We also supplement that list with a matching of keywords. So for instance, this address does not have any named slum in the text. However, the presence of the word Zhopadpatti, which is the Marathi language word for slum, that we classify as a slum address based on that. So all through the whole data, we classify approximately 55% of the records as slum addresses, which is consistent with the overall population measures of slum residents in Mumbai. So how does this, just to check that we're getting meaningful information out of this slum classification, we do find that areas that are known to have high concentrations of slums have a high proportion of deaths in slums, and areas that are known to not have a large slum concentration have a smaller proportion. And we can also look at the mean age of death as it relates to the proportion of deaths in slums, and places that have higher proportion of deaths in slum are seen to have a lower mean age of death. There are a number of other data sources we use. I'll bring them up as they arise in the analysis. Okay, so moving on to the empirical strategy here to get at the causal effect. We saw some correlations earlier, but now we want to estimate this causally with an econometric design. So what's happening here is we want to estimate the effect of daily rainfall on weekly mortality, a nonlinear effect of daily rainfall on weekly mortality. So the outcome variable is the deaths in pin code I in a given week, W in year Y. And the key explanatory variable is basically daily rainfall values in that week, as well as in 4 lagged weeks in our main specification. So we want to also get a persistent effect, hence the inclusion of the lags. The fixed effects here flexibly control for citywide shocks in the week, including citywide average rainfall conditions, as well as annually varying pin code specific shocks. So the remaining identifying variation is coming from idiosyncratic spatial variation in where rain falls in a given week. So we estimate this model using Poisson regression for the entire sample, the entire population, as well as relevant subgroups here. And the way we're getting at the effects of daily rainfall is that we're constructing basically a polynomial functional form to get at the nonlinearity. And we take the polynomial powers of the daily rainfall values before aggregating them to the weekly level to match with the mortality variable on the left-hand side of the regression. And this is being done for the contemporaneous and 4 lagged weeks. So this gives us a mortality response to rainfall, which we graph in this way. So this is showing the effect of a day with the rainfall indicated on the x-axis on the 5-week mortality. So we find that a day with 150 millimeters of rainfall causes around 2.2% increase in 5-week mortality relative to a day with no rainfall. And the nonlinearity is very evident here. Things get much worse at extreme rainfall values. So at a 300 millimeter rainfall day causes around a 7.5% increase in mortality. This is for the population as a whole. And this is the cumulative effect over the 5 weeks. If we look at the breakdown of like the timing of when that effect is playing out, we see that there is an effect in the contemporaneous week, but there's a very persistent effect over the subsequent 4 weeks as well. So again, this and the cumulative, these are both for the population as a whole. If we look at different subpopulations, we see that things are very unequal. So if we look by age group, children under 5 are the worst affected age group. We see some evidence that women are worse affected than men. It's not entirely clear what's driving this, though a few minutes into the further, I'll try to disentangle what's going on here. Slum residents are substantially worse affected than non-slum residents. So by these 3 groupings, age, gender, and residence, we're seeing quite stark inequality in the mortality impacts of rainfall in this setting. So we also, in the paper, we tried to look at further intersections of these 3 categories. The estimation does get a bit noisier. However, one thing that stood out is that the male-female, the gender differential seems to be driven entirely by non-slum residents. So there's not much gender differential among the slum resident response. It seems to be entirely driven by the non-slum resident response. So in the paper, we did try to go into this further, and this kind of pattern here in the differential seems to be driven by the 65 plus age group. So suggests that this is not something about childbearing. That doesn't seem to be the first order story here. We did try to disentangle what's going on. It seems like the age composition is a likely factor. So we find that 65 plus non-slum resident females tend to die at considerably older ages than their male counterparts. And so it could be that these older people are more vulnerable to dying. If they make it to that age, they're more vulnerable to dying from these rainfall-driven causes. However, we don't have the cause of death. This is all kind of suggestive evidence, but of a very intriguing pattern here that deserves further exploration. So on the slum versus non-slum inequality, so it begs the question, are slums doing worse simply because they're situated in areas that are more flood prone? So we try to disentangle that here by looking at high elevation pin codes and low elevation pin codes separately. And we do find that even within each elevation group, the slum residents are worse affected than non-slum residents. So there is some evidence that the low elevations are worse affected than high elevations, but within each elevation group, the slum residents are doing substantially worse. Okay, there are a number of robustness checks we have in the paper for these results. In particular, we did try to include additional lags and find even further persistence of the effects beyond 5 weeks. So we should consider what we do here as a lower bound. However, adding additional lags cuts out the amount of data we can use. So the main results presented are for 5 weeks, though I would like to caveat they are likely an underestimate for that reason. Another concern here could be measurement error in the rainfall data or the mortality data. So we try to see if the results hold up, if we randomly scramble the rainfall values and re-estimate this mortality rainfall response. So if this is real, then we should not get this kind of positive relationship with the scrambled values that we see with the true values. So we indeed find that the response is only there with the true values and not with the scrambled rainfall values. So we have a few different versions of randomized scrambling of the rainfall. This leftmost one is just a full shuffle across the pin codes and dates. The second one is shuffling the rainfall across pin codes, but within the date. So basically changing up the spatial pattern. And this last one is shuffling within a location, but across the dates. So changing the temporal pattern. And in all three of these versions, if you look at the 1st to 99th percentile of the fake, the scrambled responses, we find that they're 0 on average, and that the true response is far outside this envelope of the fake ones. Okay, so everything we've shown so far has been in terms of the effect of daily rainfall on mortality. However, we have very rich rainfall data here, and we can exploit sub-daily occurrence of rainfall in each location. So we also estimate here a nonlinear function of hourly rainfall on weekly mortality using a similar approach here. We just take polynomials of the hourly values of rainfall before aggregating to the weekly level. And we find that an hour with high rainfall has substantial excess mortality effects over 5 weeks. So for instance, a single hour with 30 millimeters of rainfall results in about a 0.5% increase in 5-week mortality. So this is interesting in and of itself, but it also opens up the door to leveraging the co-occurrence of rainfall and high tides. So here's this is just an example of late June, early July 2007, what the tide height fluctuations look like. So these are astronomical tide heights. And we have very granular rainfall data here that we can basically line up to say, like, did rainfall occur during a 400 centimeter tide or during a 100 centimeter tide, and anything in between. So this is what, over that same time span, we find that there's sometimes the rain fell during a high tide period, other times during a low tide period. So basically overlaying the rainfall with the tidal fluctuations. And so high tides are known to impair the drainage capacity in this setting, as well as in cities around the world, as we see in the hydrology literature. And rainfall that occurs during such a high tide period can be expected to generate greater flood hazard than rainfall during a low tide period. So we estimate a model that basically includes interaction terms of the rainfall during the hour and the tide height during that hour to differentiate the effect of rainfall during high and low tides. And this is what we find from that. So we indeed find that rainfall during low tides is not as harmful, and rainfall during high tides is especially harmful. In the paper, we also run a version of this using just the daily average tide height and daily rainfall instead of the hourly. And we find very consistent results that rainfall during high tides is especially harmful, even if you measure it that way. Okay, so this is, again, very illuminative of what's driving these results and what can we do to avoid these kind of adverse consequences on people's lives. And another thing that's opened up here is that we can leverage this kind of an approach to assess the effects of future sea level rise, and I'll get into that shortly. But so moving on here, we've sort of presented what are the relationships between rainfall, tides, and mortality. What does this all add up to? Like, how much is this really harming people's lives? What are the damages here? So we can calculate the number of deaths that can be attributable to these rainfall shocks. Basically, taking our model, we can take the total expected deaths predicted by the model using both the rainfall and the fixed effects, and then subtracting the expected deaths from the fixed effects only. That's the predictable deaths. And the difference of those two things will give the deaths that are due to rainfall. And we can calculate this for the various models estimated and shown earlier. So we find that this excess mortality burden of rainfall accounts for a very substantial portion of overall mortality. So around 8% of total deaths, and even higher percent, so 17% of under 5 deaths. It's also very much burdening the slum population, as we see here. So to put these numbers in perspective, so 7.3% of Mumbai's total deaths around this time period were caused by cancer. So this is comparable to cancer in terms of its mortality consequences. So these are just proportions of total monsoon season deaths. What are the total number of deaths that this represents? So this is around 2,500 excess deaths per year. And if we look at the breakdowns across these subpopulations, 90% of this excess mortality burden from rainfall is borne by slum residents, the most vulnerable communities in the city. Okay, so this is the looking at the present. What does this imply for the future, as we're going to see rising sea levels? So this was the same tidal variation example I was showing for late June, early July 2007. If we were to elevate all these tide heights just uniformly by projected levels of sea level rise, we would see what it looks like here for 30, 60, or 90 centimeter elevations of sea level. And we can see how much the excess mortality would be if we were to raise up all the tide heights by these values. So we found, like I said, around 8% excess mortality. The excess mortality burden was 8% of overall mortality just with no sea level rise. That's the benchmark. But if we have a half-meter sea level rise, that burden goes up by 50%. So it would go up from 8% of overall deaths to 12 to 13%. So we can see this kind of things get even worse at higher levels of sea level increase. So this is a sea level rise. The health consequences have never been quantified before. So this approach provides some way to get at this unknown harm from higher sea levels. Okay, so coming to the conclusions here, so we find that localized rainfall shocks cause large persistent increases in mortality, with the most vulnerable groups in society worst affected. There seem to be, these results suggest large potential benefits to protective investments. These could be in the form of improved housing, improved waste management, sanitation, drainage. Future research should definitely try to get at these benefits and quantify what they could be. So if things are bad today, they're likely to get worse under future climate change unless we can adapt and re-engineer. Climate change poses hazards both in terms of intensified rainfall as well as sea level rise. And these results point to a new channel through which sea level rise can endanger human lives. And again, emphasizing the importance of these adaptive infrastructural improvements. And finally, the methods developed here do not require complex data. So often in developing cities, there are not detailed flood maps or detailed drainage infrastructure maps. However, this approach here can help us to quantify who's harmed the most from extreme rainfall and possible solutions to this. And future research should extend this to other cities throughout the world, such as the ones pictured at the beginning of this talk. Okay, I am just about out of time. Thank you for this opportunity. I look forward to your feedback, both now and feel free to email me also afterwards. Thank you.
All right. Thanks a lot, Professor Rode, for sharing this very interesting research. For our audience, if you have any questions, please feel free to type your questions in the chat box. Right, so I would just like to mention that in our last event, we talked about a project that a team here at PKU is currently undertaking, which is trying to collect a lot of data related to like both environmental health and human health, and trying to make predictions about like what the future would look like given the planetary boundaries and also the current state of knowledge related to the intersection between human health and these environmental factors. And I think Professor Rode's work, the work that you presented today, is a really great example of like how we can use this kind of econometric method, quantifying the relationship and then make predictions, right? Yeah, so I think that's very helpful for the team here to learn, and also for other teams who are trying to do similar work. Right, so while we wait for other questions to arise, I would just like to ask several questions that I had when I listened to the talk. So the first is like a very quick data clarifying question. So Dr. Rode, I think you used a lot of very novel data set, like you mentioned in the beginning. So I was kind of curious about the mortality data. You mentioned that the government website does have this kind of death record, which I think is like a really powerful data set, but I was just curious about how the data is reported and collected, and whether is that self-reported or something else? Because I was thinking about whether there will be differential reporting or recording between residents in the slum or non-slum residents. Yeah, I'm curious about this kind of the data generating process for the mortality data.
Okay, should I answer questions one by one?
Yes, please.
Okay. Yeah, that's a great question. So this is from the vital statistics collection system. Independent audits have shown that this is one of the best systems in India of vital statistics collection, and it's found it to be around 95+% complete. That being said, yeah, it's possible that it's more or less complete depending on the subpopulation. So one evidence is we don't seem to find systematic. I mean, the placebo responses are not showing an effect. So I mean, that doesn't assure that it's complete necessarily. But we do, at least in this setting, even among slums, for instance, most of the deaths, like over half the deaths, are occurring in hospitals. So it's likely that the vital statistics registration is present and operating even in slum areas. However, I don't have an exact, I don't think that independent audit distinguished between the subpopulations, just that it was around 95% complete.
Yes. Yeah, sure. Like I think the data is often the thing that we struggle the most with. And definitely I think you and your team have put a lot of effort to check, to know the data and also to check whether the potential bias in the data might affect the results. And yeah, I think the kind of like placebo exercise you mentioned definitely helped. So I think probably that is also related to my second question, which I've been thinking about throughout the talk, which is about the mechanism. I think probably you and your team have also been thinking about this, right? So I think the empirical evidence are kind of pretty compelling that the rainfall is causing more death, elevated level of death, right? But like, what is exactly happening here that is making that people die more on rainy days? Because we know that people have like this kind of adaptation behavior, right? For example, we know that in days that are really hot, have high or low temperature, people might avoid going out. And also you mentioned that like you see a lot of that in hospitals. Is that because people get sick more on rainy days? And also kind of like we know that when there is like a flood or something, there might be infectious diseases, right, following that. And I think probably that's why you see a 5 week after a rainy day, you see elevated mortality. But if that is what is happening, is it possible that the localized rainfall impacts could have spillover mortality impacts on like adjacent regions or things like that? I'm just curious about like when you study this, what are some of the stories behind the finding?
Yes, that's all great questions, and I wish we had things like cause of death to shed more light on them. That being said, so a few things, a few patterns do suggest something about the mechanisms. So, for instance, the like you said, the lagged effect suggests diseases that take time to spread. Also, the fact that the under 5 children are the worst affected. The medical literature has established that like diarrheal diseases affect this age group the most. So that's likely to be a big part of the story. And then the tide is another piece of evidence that this is caused by flooding and accumulation of rainwater and breeding diseases and spreading contaminants through that. That being said, yeah, we don't have the cause of death. But these are consistent with certain narratives. The other point about adaptation, yeah, this is the results should be interpreted as net of any adaptive actions people are taking. So if people are, for instance, boiling water for drinking in the monsoon, this is net, and then the adaptive actions may be different across different subpopulations that could contribute to the inequality, unequal effects. And then spillovers, that's also a great point. So in the paper, we do try to assess the extent of spatial spillovers by estimating at wider geographies. And we don't find much evidence of spatial spillovers. We recover similar effects if we widen the geography. But it's possible that, I mean, we cannot estimate this for the whole city because our fixed effects would not be possible. So a comparable estimate for the whole city is not possible. So there could be some very wide-ranging spillovers across as people commute across the city. But the evidence suggests that there doesn't seem to be a huge spatial spillover.
Cool. Yeah, thank you. Without the cause of death, there's definitely like a lot of questions that might be very difficult to answer. But definitely you have done a lot of work trying to get at some of those mechanism questions. Right, so now we do have a question from our audience, which is from Professor Qiu Yun at Jinan University. And Professor Qiu asked, Dr. Rose, thanks for your talk, and I'm curious about whether the mortality impact of precipitation is larger or smaller than that of temperature. And then the second question is what policies or public infrastructure can reduce the impact of precipitation? And can we use similar policies or public infrastructure to help people better adapt to the impacts of precipitation and temperature?
Yes, precipitation versus temperature. So in the paper, we do have a version of where we estimate the temperature response. It's not quite, so the fixed effects that we use soak up a lot of the spatial variation in temperature, since there isn't much spatial variation in temperature, right? So what I mean to say, these fixed effects are already controlling for the citywide average temperature on the given date. So we can estimate, we do have temperature data across space, but there's just not much spatial variation in temperature on a given day, like there is variation in rainfall on a given day. So we do estimate a temperature response. Also, we don't find as severe effects as rainfall. And also other work on mortality due to temperature in urban India. It's, I mean, there's a few studies on that, but some of them are showing that it's more of an effect on rural areas than urban areas. So I would say rainfall is very important, at least as important as temperature in this setting. And the adaptations, yeah, I would say just based on even on anecdotal, what people think needs to be done is, so what happens is drains are often clogged due to construction debris being thrown into them, and the government looks the other way. So this is a recurring problem in Mumbai and other places around the world. So yeah, drainage and then sanitation, proper waste management, these are likely to go a long way in reducing these harmful impacts.
Thanks, Professor Rode, and yeah, thanks, Professor Qiu for your question. Right, probably for our audience, if you have more questions, feel free to tap them in the chat box. And I do have like one last questions for Professor Rode, because you mentioned at the beginning that show some evidence of the megacity, the size of the megacity, and the prediction of the size of megacity in probably like 2100, right? I was just curious, what are the effects that we are finding here relates to the fact that Mumbai is a megacity. Just like think about like a hypothetical scenario, if like the Mumbai is divided into two cities, are we still gonna find the same results that we are finding right now?
That's a good question. You mean if there were two governing bodies over the same population instead of one?
Right, right, because right, we are thinking about mega cities in the future, right?
Yeah.
And whether this kind of issue is more severe in mega cities relative to non-mega cities.
Yeah, I mean, ideally we should run this in different cities. but yeah, megacities, besides the administrative boundaries, they're also extremely dense, right? So that urbanization and density creates conditions where this kind of flooding happens. Like the one thing is like natural sources of drainage are built over, right? And so urbanization often occurs in haphazard ways. So it's possible that that kind of haphazard urbanization would be worse if it was two governing bodies that didn't coordinate with each other versus one body. It could go that way, right? But in any case, I think good governance is definitely part of the story, like making sure that drains are not allowed to be clogged with debris and that kind of thing. So that's definitely part of the story here.
Yes, definitely. I was thinking about the same because you mentioned the infrastructure, the drainage is kind of like one of the important like public policy tools that we can alleviate this issue, right?
Mhm.
Probably that has something to do with the governing bodies, whether the coordination between like different governing bodies or the capacity of one governing body to manage like a mega city, right, relative to like a smaller size city, right? Okay, thank you so much. Right. Yeah, I think we don't see further questions coming up from the audience. And I think we heard a very like inspiring talk and had like a wonderful conversation, a discussion about what we can learn from this paper. So thank you so much, Professor Rode. And thank you, Karen, for being here and introduce our session today. Right. So, and thank all of our audience for joining us here today. And hope everyone have a good rest of your day. Thank you all.
Thank you all.